Dear participants, we are happy to start our session, which called Country Adaptation of the Standardized Package of Community-Based Services to Improve TB Outcomes and to see among participants all of you. My name is Yulia Kalancha and I'm the TB Europe Coalition Executive Director, and I will be chairing this session together with my co-chair Christina Chelan, Program Coordinator of Center for Health Policies and Study. As we all know, community-based supportive services, which include social and psychological support for people with TB, are an integral part of people-centered and right-based TB care. And strengthening the role of local communities in the provision of support services is also envisaged by the concept of universal health coverage. And in addition, as part of the transition from donor to domestic funding, it is really important to have a sustainable mechanism for financing of civil society organization activities through social order mechanism. However, the lack of extensive experience and best practices in EECA region in contracting civil society organization and evaluating results prevents governments from developing effective collaboration with civil society and communities. And at the same time, there is a clear need for patients, for civil society organization and communities to become part of delivery of TB services where it is possible by building their capacity and developing a legal and regulatory framework for contracting. In response to this challenge, a standardized package of community-based support services to improve TB outcomes was developed by WHO Europe, PASS Center, and TB Europe Coalition within the TB 2.0 project. And in this session, we will present key tools that have contributed to the rapid adoption of the standardized package at the national level by both the public sector and civil society, as well as discuss lessons learned and recommendation for adaptation to other countries. And with this, I would like to pass the word to Christina, who will present our honorable speakers. Christina, please.
Yulia, thank you. Thank you, dear attendees. So we will go through the three presentations that we have today. Three great speakers, which will speak. The first one will be Stella Bivel, who is the Strategic Advisor to Division of Country Health Program Director at WHO Regional Office. And she will speak on the adaptation of the standardized package of supportive services as one of the most important prerequisites for the implementation of a social order. This will touch base on the developed standardized package itself, about also the 12 services that were included in these packages, the methodology of cost of these services, and also she will show us a template of a standard. And she will speak also on the tools that were used in countries for rapid adaptation and rollout. The second presentation will show us the experience of one of the countries who adapted among the first the package, and this is the Republic of Moldova. We have Diana Kondratsky, who is a doctor at the NTP coordination unit, who will speak about the specific of the adaptation of the package in Moldova, communication with the country stakeholders, communication with the Ministry of Health, and also all the processes that brought finally to the adapted to the country needs package of services. Also, we have another country here to speak, and here we'll have the civil society perspective. We have Mrs. Parvana Valieva, who is the executive director of Saklamliga Hidmat Public Union. Also, she is a TBEC board member and oversight officer of the CCM in Azerbaijan. So Parvana will speak again on all the processes needed for the adaptation, but from the perspective of the civil society. So let's go ahead with Stella's presentation. Thank you.
Good day. My name is Stella Bivel, and I am a strategic advisor for infectious diseases at WHO Regional Office for Europe. And I will present the adaptation of the standardized package of support service, a prerequisite for social contracting. Ending TB requires not only investment in strengthening tuberculosis programs, but also investments in rights-based, people-centered care. WHO consolidated guidelines on tuberculosis Model 4 delineates clearly evidence-based practices that are needed to ensure that people with TB are successfully treated. This includes a list of care and support interventions for all people with TB, including health education and counseling, a package of treatment adherence interventions, tracers, material support, psychological support, and staff education. And there are clear recommendations which treatment administration options can bring better benefits over the, let's say, older ones. Community or home-based treatment support is recommended over health facility treatment or unsupervised treatment. Treatment support administered by trained lay providers is favored over treatment administered by family members or unsupported treatment. Video-supported treatment can replace in-person treatment support when the video communication technology is available. The consolidated guidelines also mention the models of care for people with drug-resistant TB, which should be treated using mainly ambulatory care than models of care basically based principally on hospitalization. A decentralized model of care is recommended over centralized model of care. And family models of care for children are also favored using a family-centered approach. So when we look at this in the European region, this work has already been happening since 2016, when the blueprint to introduce the people-centered model of care was developed as part of a joint collaboration of WHO Regional Office for Europe with the Center for Health Policies and Studies, TB Europe Coalition, and the many technical partners and civil society around the region. This was done under the regional grant, TBREP, of advancing the people-centered quality TB care. And the second phase from TBREP 2.0 was to move from the new model of care towards improving early detection and treatment outcomes. And it was funded by the Global Fund in 11 countries in Eastern Europe and Central Asia. There were two key products that emerged from that wonderful collaboration. And one is the standardized package of community-based services to improve TB treatment outcomes. So what it is, the standardized package of community-based supported TB care? This is includes social and psychosocial support for people with TB and are an integral part of TB-centered and rights-based TB care. Strengthening the role of communities in the provision of support service is also envisaged by the concept of the health coverage. So this is an approach to summarize a sample of essential non-medical TB services to further adaptation as community-based supportive people-centered services to improve TB outcomes in terms of epidemiologic context, needs of TB patients, and key populations. It also pays particular attention to key populations by recommending a set of community-based services to better engage and reach key and vulnerable populations and to meet the complex and comprehensive needs of people affected by TB. So the document provides a detailed description of 12 support services as well as a methodology for calculating their cost as well as a practical budgeting tool. So these are, the way I always say, this is a puzzle-like modular kind of approach. So there's a list of all of supportive services across the whole continuum of care, starting from health promotion, health education, TB testing and treatment, detection and diagnosis, which includes active case finding in key populations, and so the services support for active case finding. Then it goes to treatment to ensure continuity of care and avoiding interruption of treatment, and there are two different services there. And care and support is patient care and support that includes all the details that you see, the needs assessment, mental health and psychological counseling and support, case management, material support, case education, as well as post-treatment support. So the matrix of services also includes a consideration for working with key and vulnerable populations across the continuum of care, and pays particular attention. The document recommends also to engage affected communities and civil society actors in service delivery, and provides practical tools for such recommendations. The special populations and special situations that are included are community-based service for prison populations, community-based service for homeless people, a family-based approach for treatment in TB in children, and support services for TB during health emergency. This was a newer addition, as we understand, because of the situation of public health emergency related to COVID, and now humanitarian crisis. So each of these services has a very clear structure that follows a standardized way to present. This is an introduction, scope and objectives, target audience, service delivery that includes initiation and planning, duration of the service delivery location, resources needed for the service delivery, as well as a specific section on evaluation and reporting that includes the indicators and also the process, how to get there, and a service delivery algorithm so that it's all clear who does what in terms of a mapping of individuals and service providers. So for the sake of this standardized package of service, a service provider is an entity, non-government, not-for-profit or for-profit, or a private entrepreneur and any other legal status according to a national legislation that delivers community-based TB service. The service provider has to meet certain requirements to ensure delivery of quality TB service. So the requirements for staff qualification and training, organizational management, availability of necessary means and equipment are also listed in the package of service, as well as the premises if they are necessary. It's also important to note that community-based services can be provided by both medical service, but non-medical professionals, including patient supporters, social workers, psychologists, community workers, who need to have adequate training and skills to be involved in service delivery. So, to make sure that there's also clear accountability for the services provided, key performance indicators are included in each of the services that are listed, with including quantitative indicators, and the monitoring of the quality of service provision is very important, and unit cost of services is also listed as a performance indicator. So when we talk about government providing non-medical services or support services, there are two elements that are very important. One is a service standard, and the other one is costing according to the national costing methodology. So an additional tool of the standardized packages, that it has an Excel-based tool that facilitates unit cost calculation. It is open. It allows for country-specific configuration of service delivery organization, and allows for flexibility for reflections of country-specific unit cost patterns. And it allows to first for the governments or the providers to plan for and budget for community-based TB related interventions, as well for the service providers to ensure that they know what there will be their resource requirements to provide a certain number of services to a certain population. So my final slide is to note that the most important thing is not to develop a package, but to implement it. So for us, the most important element was the adaptation, the country adaptation. So using the standardized package, these standards and operating procedures were implemented in 9 out of the 11 countries that were engaged in the TBREP grant. And as a result, the document was adapted to the context in all 9 countries and is already integrated in the national regulatory level in 4 of them. This exchange of experience at the regional level has greatly contributed to the progress made by the countries. Since having similar programs, the countries were able to learn from their counterparts and in other countries how to overcome them. So I will stop here. You will hear from my colleagues on the specific country level adaptation experiences, and I look forward to stay online and answer any questions if available. Thank you.
Thank you to Stella. Now can we have Diana's presentation, please?
Good afternoon, dear colleagues. My name is Diana Kondratsky, and I am the pneumologist of the National TB Response Program in Moldova. And today I will present the adaptation of the standardized package of support services for Moldova, our experience and next steps. The work on standardizing the services provided by CSO active in TB response in Moldova started back in 2017, led by CSO when the guideline standard operation procedures for NGO intervention in Moldova was developed. The notice that CSO are providing supporting TB services for TB since 2007 with a scale up in 2010. When in 2021 was developed the standardized package for community-based supportive services for TB by WHO, PASCENT and TBIC, first thing we did together with colleagues from CSO, analyzed both documents and made sure they're aligned and well correlated, and developed the service package using the same approach as in the original document. After that, we proceeded with the cost calculation. We hired an international consultant, one of the costing tool authors, and who supported us in applying the methodology and calculation of costs for services using the Excel costing tool, using the experience and work done by CSO within current project funded by Global Fund. After the analysis of ongoing activities and their compliance with standardized package of services, mapping of services, the consultant conducted 2 country visits to work with representatives of the CSO on data collection, discussion on preliminary cost and results of calculations. For assessment of labor costs, detailed analysis of all stages of activities for provision of each service was conducted, including evaluation of working time of each staff member involved in the service delivery process. Final data on this component used in cost calculation reflects the actual experience of CSO, which have provided the relevant information. A key component of the costing exercise was to identify the optimal salary scale for the staff involved in service delivery, given the essential differences between officially approved salaries in public sector, health and social services, current salaries of CSO staff under donor-funded projects, and their expectation for future contractual arrangements with National Health Insurance Company. Thus, calculation of salaries costs was done using two approaches. Option 1 is based on existing official gross monthly salary scale of compatible staff positions in health or social sectors. Option 2 reflects the expectation of the implementing CSO as expressed during the discussions. Final estimates are based on comprehensive analysis of the situation, taking into account existing payroll tax system in the Republic of Moldova, reflection net, gross and total salaries for each category of staff. For assessment of material costs as well as transportation and communication costs, the actual data provided by CSO was reflected in cost calculations. For assessment of the ratio of indirect overhead costs to the direct costs, actual data from 3 CSO was collected and analyzed. Based on conducted activities under the costing exercise, the following conclusion and recommendation were presented by the consultant. To ensure the required quality of the provided services and achievement of the set targets for TB prevention and treatment, it is necessary to take into account all relevant cost components and their real costs. EE prices for services should be economically sound. It is also necessary to utilize the available country experience, including existing human resources with the CSO sector, which has developed key skills and knowledge in this area over the last years. All inputs required for service delivery should be revisited and adjusted for expected changes associated with the transmission to internal funding sources. When developing average costs for national-wide contracting, it is advisable to use a mixed costing approach, a combination of normative and factual costing when certain cost components reflect the actual experience of projects implemented in the past. Example for material, transportation, communication costs, while for other cost categories, labor, overhead costs were estimated based on assessment of available data. A key component of well-grounded costing is to use responsible, reasonable salary estimates, which sound reflects a compensation scale necessary for both attraction highly skilled workers with relevant experience and knowledge, and to be connected to the real situation in the labor market of the country. This conclusion and recommendation were presented and discussed with the national stakeholders during a 2-day workshop, upon which we went further and adapted the document, the metrics of services and cost of services, and submitted to Ministry of Health for further approval. We saw that in the Republic of Moldova, there are opportunities for CSOs to access both donor support and state funds. Since 2020, National Health Insurance Company is contracting CSO for TB screening and currently is waiting to the approved package and cost to operate further in this field. To improve the quality of services and at the same time to access funds at the national level, it is necessary to approve standards for accreditation and the quality of services provided. Draft accreditation standards were developed and will be submitted for approval after the standards of services are approved. From the perspective of a governmental stakeholder, we see the package of supporting services developed and proposed at the regional level as an important tool that allows countries and combine nationally developed documents with a standardized package while guaranteeing a set of qualitative and quantitative indicators. Thank you.
Now, let's hear from Parvana.
Good morning, good afternoon, and good evening from Azerbaijan. I'm Parvana Valieva, Executive Director of Sağlam Ahmet Public Union and consultant to CCM Azerbaijan on oversight and transition. Thank you for inviting me to present the country stakeholders' work in adopting the standard package of supportive TB services. And I would like to greet our chairs and wish good luck to other speakers of this session. The main rationale and the background for adopting this standard of the TB services, I would like to say that as in EECA region in our country's transition from donor support to domestic financing is on the country agenda, and the Global Fund, the biggest donor, gradually leave the country and hand over the services to the government. And during this transition, civil society organizations and community-based services lost their main financial resource to deliver essential TB services to mainly affected key population groups. The lack of experience and the best practices in contracting with civil society organizations as social contracting mechanisms, and also effective collaboration with civil society and communities, and need for the patients to become part of the delivery of TB services, and also building civil society organizations' capacity in developing a legal and regulatory framework for contracting was the main background and rationale for adopting this standard package of TB services in our country. And for the first time, correspondence with Minister of Health and also National TB Program was conducted with TBEC and our NGO, and they agreed to adopt this package of TB services in our country. Then two consultants were assigned by Minister of Health. The consultants were NTP employers, Director of Research Institute of Lung Disease, and Financial Manager of the Institute. And as in Azerbaijan, main medical and social services are financially supported by the state agency on mandatory health insurance. One consultant was requested to adopt costing tool from the agency. The agency officials assigned head of actuary and risk management section department head for this consultancy with an order of the director of the agency. And the next step, working group launched, and the working group meetings was played a very important role during the process. The working group represents consultants as well as TB Azerbaijan NGO coalition members, mainly civil society organizations, and the director of research of lung diseases was coordinator of the working group, and they are responsible for organization of the working group meetings in the institute. Services package, after discussions and working some months on this service package, 10 services included in the package. Mainly they are awareness raising activities, community mobilization, massive open online courses, counseling to TB patients and their household contacts, support for active case finding, and etc. The main services included in the package. The services calculated as a 1-year basis services, and it has a costing methodology, costing tool, in Excel, and methodology part. Methodology is an integral part of the regulatory document. The costing methods were identified according to national legislation and financial regulations. And the costing tool is a guideline for the purpose of pricing of community-based supportive TB services. Calculation of the services, as I said, it was mainly based on the national legislation as well as the regulatory documents. And in some cases, we also consider the market prices during the budgeting. After developing the document, the completed document was reviewed by the chief consultant and handled to the head of National TB program for making review and amendments. The document then was forwarded to the Medical Scientific Council of the Republic of Azerbaijan to review by the council members, provide comments and giving feedbacks. The council notified its appropriateness and necessity and supported the document, giving a status as a methodical teaching aid. And the document was endorsed by Minister of Health as a recommendation and methodical material with the decision number 28 on 17th of December in 2021. This document is a guidance for new beginners civil society organizations to configure and design their activities according to national identified and endorsed standards. The document is used as a methodical material for medical students and also certified doctors. The document is play main important role for having a sustainable mechanism for financing civil society organization activities through social order mechanisms. We have some recommendations to other country representatives. Although the document of adaptation was responsibility of the state assigned consultants, CSOs, interventions, and committees were very vital in the process. During the process, CSOs' advocacy and awareness on the document importance led to speed up getting endorsement by the Minister of Health. And also our NGO coordinated the development of country-specific service document, service package. NTP and also Mandatory Health Insurance Agency prepared the standards based on our needs, NGOs' needs and challenges, and refer to the services currently implemented in our country by the CSOs. Thank you for your attention.
Dear colleagues, dear participants, we appreciate our speakers for the comprehensive piece of information about the standardized package itself and also about the country experience in adopting the standards from both NTP and civil society perspective. So dear participants, we are glad to open a Q&A session. Please, if you have questions for the speakers after presentations, write them in the chat indicating the speaker to whom you are addressing this question. So I see that we have the first questions already, Christina, so I'm giving the floor to you.
Yes, thank you, Yulia. And we actually have a few more questions for Stella as well. But as far as she's not with us, we'll focus only to the speakers, on the questions to the speakers that are present with us here. And we would like to ask people who addressed questions to Stella to leave their emails in the chat, in the same chat, Q&A chat, and we will pass your questions for an answer. So we have now a question for Parvana. And yeah, Parvana, is there a volunteer a community health worker or any cured TB patients engaged at the community level in your country, probably in terms of providing services in the context of TB? Thank you.
Thank you, Christina. Thank you very much for this question. Yes, of course, in our country we have TB volunteers, also cure TB patients who help us in awareness campaigns when we train TB patients, people affected by TB, the family members. They, of course, involved in these activities. Awareness campaigns to motivate people with TB on treatment. We even have ex-prisoner cured TB patient who can present himself to the audience, not shaming, not affected any feeling any stigma, and he can encourage patients to complete their TB treatment. Their role is very important in TB response, we think.
Thank you, Parvana, for the comprehensive answer. I hope that if there will be need for more clarifications, we'll still have questions in the chat. Now we have a question which is addressed both to Diana and Parvana, and it relates to the country context. And we would like to see your opinion on which entity in your country would be the most relevant to finance the community-based services, and which you see which mechanism for contracting of those services do you think would be feasible in the context of your country. So we would like Diana to go first, and then Parvana will be glad to hear from you. Thank you.
Good evening, everyone, and thank you for question. Taking into account the experience Moldova already has, probably it makes sense to continue the contracting of non-medical services the same way as medical services through the national insurance company. The only thing that should be changed is to allocate budget for the services and include it routinely in the annual budget designated to services. In Moldova, there is already practice of contracting CSO for TB screening activities, but this has a sporadic nature, is not well planned in advance, and usually uses the prevention fund or the national insurance company. Once we have the standards approved by the Ministry of Health, that CSO can accredit for the provision of the services, the NGOs can apply for funding.
Thank you, Diana. Parvana, do you want to share your opinion in the context of Azerbaijan, what you see that is feasible, and how you envisage the contracting of the civil society organizations for the community-based services? Thank you.
Thank you, Christina, for the question. We think after the Global Fund, which is the bigger donor in the country, leave our country, it will be a mandatory health insurance agency to finance civil society and community-based organization services in TB response, because in recent years, Azerbaijan government increased health financing to Ministry of Health as well as to mandatory health insurance agency. Also, the population pay insurance fee to figure out its budget. So it is feasible from civil society point of view to get financial support from mandatory health insurance agency. There is still not a
social contracting mechanism in the country, but we have regulations for providing social orders to civil society. We have this practice from coming from the Ministry of Social Affairs, and we think as a result of strong advocacy and communication with the Ministry of Health, mandatory health insurance agency, as well as the government itself, we can increase financial support to community-based organizations in TB response.
Thank you, Parvana. Thank you, Diana. And probably just a quick question for both of you as well. So you passed through the process of this adaptation. And we saw in Stella's presentations that we have 9 countries in this region that passed through the same process as you, but there are a lot of other countries that did not start yet or are just starting the adaptation, and probably the rollout will come later. If there will be such possibility, will you be available to share your experience, learning sharing for other countries, and experience sharing in this field? Thank you. Diana? Or Parvana, please go ahead.
Of course, we are able to share our experience. Moldavian experience is large in TB control, and we are ready to share experience who need our steps.
Support. Yeah, Parvana, please.
Yeah, as Azerbaijan team, we are also ready always to recommend to share our lessons learned and all the steps that we passed away. So it is a great pleasure for us to share our thoughts, our achievements with other who
Yeah. Thank you so much, Parvana and Diana. I see that we have another question right now, but it's still invisible. Unfortunately, we do not have enough time to answer this, but I want to voice it, and maybe the person who addressed it can leave the email so that our speakers can answer it in personal communication. So the question is, it's more the comment than the question. I see use of this package as a potential the best way to ensure continuing funding for civil society organization. If is early days yet, but do you see it continued funding based on this package in Moldova and Azerbaijan? Maybe if we have 1 minute for each of you, Diana and Parvana, maybe you can answer it, but just 1 minute for each of you.
Maybe 1 minute for both of you. So who goes first? Parvana, do you want to start?
I think the question is about the sustainability of the funding for community-based and civil society organizations.
Yeah, if you envisage this package is the best option for civil society to receive funding at the end.
Yes, of course. When the donor would like to give to provide any funding for the civil society organizations, so they can use these standards when identify the budget and the services for civil society, as well as we as NGOs can refer this document when we prepare proposal package to present, to submit our application to big donors.
Yeah.
Thank you, Parvana. Diana, do you want to say a few words?
Christine, I believe we need to
Yeah.
finish.
Yeah. We have 20 seconds left. I think that Diana also agrees that this is a very good tool to ensure sustainability of the CSO, of the community-based services. So we would like to thank everyone who was with us, and thank you, Yulia, for the moderation, and Parvana and Diana being with us. Thank you.
Thank you so much. Bye-bye.
Bye. Bye.